Namaskar दोस्तों, welcome to channel Toxicology on Board. Today in this video we'll be discussing another DABT topic, that is with respect to animal toxins. Well, specifically we will be discussing about a brown recluse spider bite, severe necrosis. The question is related with this concept. So the question is taken from ABT recertification examination May 12, 2000. So please read lesson 9th edition page number 1293 as well as page number 1294, and this question will be related to DABT syllabus. You can go back and check in DABT brochure, page number 28. It comes under domain 3, that is risk assessment, which carries around 38 marks. And it will cover under natural occurring toxins, that is animal based. Okay, let's directly dive into the question. The question is severe necrosis may follow the bite of. Okay, we need to identify which of the following species, when they bite, it will lead to severe necrosis. So option A we have tarantula. Option B we have brown recluse spider, that is Loxosceles reculsae. Option C we have black widow spider, that is Latrodectus species. We have option D, which is a Centuroides species, which is nothing but one of the scorpion species. Option E we have tick. The right answer will be in the green text, that is brown recluse spider, Loxosceles reculsae. Okay, so these are the things you can go back and check in Clay Center 9th edition textbook, page number 1293 as well as 1294. This is your tarantula, this is your brown recluse spider, this is your black widow spider, this is your centuroid species, that is the scorpion, and these are ticks. Okay, so with this question, we'll try to read whatever the concepts we can learn with respect to animal toxins, particularly with these five options. So first, option A will discuss about tarantulas, which are the Theraphosidae species. True tarantulas are members of the family Theraphosidae. Okay, tarantulas are predators and they feed on various vertebrate as well as invertebrate prey. Okay, they are captured after innervation with venoms. Okay, first of all, this spider will go and bite to that prey, because of which innervation takes place, that act rapidly, irreversibly on the both central nervous system as well as peripheral nervous system. If you look into humans, if this type of this tarantula type of spider bites, no, they will elicit mild to severe local pain at the location where the spiders bite. There you will feel mild pain. You will have strong itching, tenderness that may last for several hours. Even after the bite, also for several hours, you can still can feel the local pain, strong itching as well as tenderness. Coming to, you can also find at the local site of the bite, edema, erythema, joint stiffness, swollen limbs, burning feelings, and cramps are common. Okay, Theraphosid spiders contain several toxins. From toxicology point of view, you can remember what are the important toxins these particular spiders have, that are being evaluated for the development of two types of things. One is anti-arrhythmic thing as well as anti-nociceptive drugs. See, you have to remember this concept. Any substance is poison, but once we know how these toxins can be used for our beneficial action, then these can be used for in a positive way. So the toxin which is released by these tarantula spiders, no, nowadays they are doing a research in order to develop them as an anti-arrhythmic as well as anti-nociceptive drugs. Okay, so out of which important one are Grammostola mechanotoxin 4 and Grammostola spatula. These are the two which are under research and development and has considerable promise as anti-arrhythmic drug. In addition to that, we have prototoxin 1 as well as prototoxin 2 from Rhixophelma purinens. This is another type of this tarantula spider from that family, have promise as analgesics because they inhibit the tetrodotoxin resistant sodium channels. So you also go back and read the tetrodotoxin. It is also released by buffer toad or pufferfish. These are other types of animal from sources from which these toxins are released, and majorly they are used to block this sodium channel, because of which contractility or all these things of muscles will be muscle undergo spasm. So please go read in detail about tetrodotoxin. Okay, how the mechanism is there. Okay, so please read page number 1292. Okay, in from the Claessens, the ninth edition, table 2611. In this, they have given some significant spiders, their toxins, and the target of toxins. So, if you see in the previous slide as well as our previous slide, you can see that Grammostola spatula, and you have come across this one also, no? Prototoxins, that is Trixospelma pyroides. So, like this, what are the target? They are blocking sodium ion channel, similarly like that of tetrodotoxin. And you can see here this one, it is potassium. MS is nothing but mechanosensitive ion channels as well as calcium channel. These are the targets. Okay, so please read table 2611 in detail. Okay, then we'll read about second option, that is one of the spider it was. Option B, that was brown Recculse spider, that is Loxosceles species, brown or violent spider. In this case, no, the primitive spiders are variously known. They are there in the North America. Common names are fiddle black spider as well as brown Recculse. So in your option, you had brown Recculse spider. The venom of this Loxosceles spiders appears to contain, this is again very important from the toxicologist point of view, phospholipase, protease, esterase, collagenase, hyaluronidase, deoxyribonuclease, ribonuclease, dipeptides, dermonecrosis factor, sphingomyelinases D. So you go back and read snake venoms will be there, no? What type of poisoning component will be there? Then you will come across this word hyaluronidase or phospholipase like that. So try to integrate and read. So in case of spider venom, we have this type of all type of toxic components will be there. Venom has a coagulation and vasoconstriction property. Blood vessels will get constricted and it causes selective vascular endothelial damage. These spider venoms, no, they are adhesion of neutrophils to the capillary wall. You have a blood vessel capillary wall, no? These will go and bind to this adhesion of these neutrophils to the capillary walls with sequestration and activation. Complex will form and passing neutrophils by the perturbed endothelial cells. Okay, probably they are stopping the blood flow in the blood vessels. The bite of the spider produces about same degree of pain as that of a sting of an ant. Many of us don't notice that even when an ant bite, we don't feel that much pain. So this spider bites also you might have, but you will not able to notice it because it is similar to that of the ant stinger. But sometimes the patient may be unaware of the bite, and if he is unaware of the bite, then treatment will be delayed. Pruritus are over the area often occurs with the reddening and elevated skin temperature at the lesion. So at the site where the spiders, brown Recculse spider bite, no, you will have pruritus. You can see visually, you can see on the bite region, as well as there will be elevated skin temperature will be there at the bite location. With significant envenomations, hemorrhages may develop throughout the area. So what are the surrounding areas are there? Lymphadenopathy is common. Necrosis of the surrounding tissue maybe you can easily visualize. So these are the important symptoms. Systematic. These are where all till now we discussed about local toxicity. Once these poisonous components, whether all this phospholipase, protease, all these things, once they reach into the systemic circulation, what you will have? These are the signs. You will have fever, malaise, stomach cramps, nausea, vomiting, jaundice, spleen enlargement, hemolysis, and thrombocytopenia. So you have to remember these things. And in the case of fatal cases, which happens very rarely, preceded by intravascular hemolysis, hemolytic anemia. So also uh, read what are the different types of anemia. Okay, thrombocytopenia, hemoglobinuria, and renal failure. Okay, so that was about the brown Recculse spider. So in addition, please read table 2612, which is given on the Claessens 9th edition, page number 1293. Here they have listed out different types of spiders. You have Latrodectus red black spider, Stetoda cupboard spiders, Lamponidae white tail spiders, Myolomorphae funnel web spiders, mouse spiders, Tradopore spiders. Okay, important thing is you can try to remember, but here I wanted to concentrate on the second point. If you look into the duration of the pain, the first one, the pain is last for 36 hours. The second one is you can see cupboard spiders, it's up to 6 hours. White tail spiders up to 0.8 hours, and this funnel type of mouse spiders up to 1 hour. The pain will be there, the duration of the pain. So these are the comparison of the clinical effects of bites by some spiders of Australia. Okay, so now we'll discuss about the third option. So till now we have discussed about the uh, brown spiders, no, Loxosceles species. Now we'll discuss about the black widow spider, that is Latrodectus species, found throughout the world in all continents. Asia, what are the six, seven continents, seven continents what we have, with temperate and tropical climates. These spiders are commonly known as black widow, brown widow, or red-legged spider. Okay, and the poisonous component that is coming from this Latrodectus species is latrotoxin. Okay, what is the nature of this latrotoxin? It is protein, that is high molecular weight protein. They are found in Latrodectus venoms. Targeted different classes of animals include vertebrates, insects, and crustaceans. This is important. Crustaceans means like cockroaches, insects, vertebrates. They're targeting. Their target. Uh, all latrotoxins stimulate massive release of this neurotransmitter after biting to specific neuronal after binding to specific neuronal receptors. Alpha latrotoxin is the most studied protein. Out of, we might have different types of latrotoxin. Out of which alpha is the most important one, most studied protein, and it is only toxic to vertebrate. There is selective toxicity. It is not toxic to insects as well as crustaceans. Okay, and it is a presynaptic toxin. So, and it exerts its toxic effects on the vertebrate central nervous system. It will depolarizing neurons by increasing intracellular calcium. So within the this neuronal cells, no, this calcium concentration will be increased. So as a result, what happen? By stimulating exocytosis of this neurotransmitter, so more and more neurotransmitter will be released out of this neuronal cells. Okay, if you look into alpha latrotoxin and its mutants, are they're versatile tools for the researchers in order to study the concept of this exocytosis. So it will help these researchers to confirm whether vesicular hypothesis of the transmitter release, okay, and the establishment and the requirement of calcium ion, how the calcium ion plays an important role in the case of endocytosis, okay. And it is a characterized individual neurotransmitter sites in the CNS, two families of important neuronal cell surface receptors. So by the bite by this black widow spiders, no, it is described as sharp pinprick like, followed by a dull, occasionally numbing pain in affected extremities by pain cramps in one of several large muscle masses, whether it is in your leg or in your hand, like that. So what you will come across, you will see that muscle fasciculation is there, and the patient will show sweating, lymphadenitis is most frequently on, followed by you have paroxysmal muscle cramps you will be having, hypertension, increase in the BP you can see, and blood studies, they do not definitely they do not show any levels till now about. So we will discuss about the third option, that fourth option, that is scorpions. Till now we have discussed about the two types of spiders we have discussed. Okay, then now we are discussing about the fourth option, that is scorpions. That was century species was there, no. So one of the more than 1,000 species are of scorpions are available. Out of which 75 are known to be cause how more poisonous, or they need more medical supervision. If you look into this one, previous one which was latrotoxin, were large molecular weight proteins. These are low molecular weight proteins, amino acid, nucleotides, and salts and other components will be there in this scorpion toxin. Short chain toxin appear to they are going to affect your potassium and chloride channel. Previous one, it was affecting calcium, exocytosis and more neurotransmitter were released. But here in the case of scorpion, whatever the toxin is there, it is short chain one is affecting potassium and chloride channel, and if you look into long chain toxins, they are affecting sodium channels. Previously calcium channel. Like this, you have to try to integrate and try to remember it. If you look into the neurotoxic fractions, are generally classified based on the molecular size. Okay. If you look at a short chain toxins, no, they are made up of this 20 to 40 amino acid residues with 3 or 4 disulfide bonds and appear to affect potassium as well as chloride channel. And coming to long chain toxins, which are 58 to 76 amino acid residues, the molecular weight is around 6,500 to 8,500 Dalton, and 4 disulfide bonds. They are mainly affecting your sodium channels. The toxins can selectively bind to specific channel of excitable cell, thus impairing the initial depolarization of the action potential. We have in the action potential repolarization phase, resting phase, the depolarization phase, no. So this particular toxins are affecting the, they are impairing the initial depolarization phase of the action potential, in the nerve and muscle, in both in neurons as well as in the muscle, resulting in the neurotoxicity. That was about the scorpion. So please read along with that in Claysen's ninth edition, page number 1292. Okay, table 2610. In this, they have given the location and some medically important scorpions. Medically important. So nowadays, some of you might know there are certain that this scorpion, the toxins from this scorpion are being used medically. They have some beneficial purpose. So please go back and read about that thing also. So in the option we have Centroidus species which are distributed in North, Central, South America. So now you might also be thinking that why we are reading so much in detail about scorpions, spiders, etc. You have to understand the examiner is from the FDA or from the American region. So these kind of spiders, scorpions, all these cases are more in the case of America also. So this is a common kind of accidental which might occur in America. So one of the topic of question will be there in the case of DABT, and the symptoms of the scorpion innovation are they are different from different species. Common offenders are family Vejavidae. Okay, the sting gives to localized pain, swelling, tenderness, and mild paresthesia. If you look into once this scorpion toxin reaches the blood, it is causing fever, muscle fasciculations. Okay, innovations by some members of genus Centroidus are clinically most important. That's why we have seen in the previous slide some of the important scorpions of medically toxic medical importance is there. In case of if you see how the scorpion toxin bite it is affecting in the children as well as adult will see. If you look into the children what it is causing, their sting may produce initial pain. Some children do not complain of the pain because we do not even know that pain has happened. The child becomes tense, restlessness, shows abnormal random head and neck movements. Another important thing is that roving eye movement. So this is the hallmark you can remember with respect to scorpion toxin. You can identify the patient what kind of bite has happened. Then centroidus sculpturus stings, visual signs including nystagmus, roving eye, and oculogyric movements. These are the important characteristic features of the bite which is caused by this type of scorpion. Tachycardia, hypertension in the child may display ataxia. Coming and also there will be adverse effects on the respiratory system which causes respiratory distress, and it might lead to respiratory paralysis. As I tell no, in case of adults, what is happening? Immediate pain after the sting, and they become tense, anxious, develop tachycardia. There will be an increase in the heart rate, hypertension, elevated blood pressure, increased respiration, and asymptomatic within 24 hours. Okay, now we'll discuss the last option. That was the fifth option. That is, we'll discuss about something about the ticks. Coming to ticks, no, tick paralysis is caused by the saliva. These ticks, when they bite, no, in the saliva you will have this kind of poison will be there, and certain ticks of families. So you'll come across these word Ixodidae, Aragacidae, and Nucleolidae. Okay, ticks are known to transmit the organism causing. This is important again. Lyme disease, Rocky Mountain fever. So they are spreading these type of diseases. Babiosis, leptospirosis, Q fever, chirolocosis, as well as the tick-borne encephalitis. Okay, tick saliva contains number of active constituents. What are those constituents? Coming to this Ixodes sculptures from this species, no, it contains ATP, diphospho, phosphorylase, which hydrolyzes ADP that is released at the bite site, thereby inhibiting ADP-induced platelet aggregation. Platelet aggregation, it will stop. Then we have kinase, ACE-like protein or angiotensin converting enzyme like protein. What it will do? It will hydrolyze circulating kinase, reduces the host inflammatory response. So inflammatory response it will decrease. Then we have glutathione peroxidase. Then we have serine protease inhibitors. All these things are there in the saliva only. Okay, of the tick, which inhibits coagulation enzymes. So somehow they are stopping the blood coagulation, the blood toxicity like that. Anti-complement protein that binds to the enzyme in alternative pathway for complement. An amine binding protein that binds serotonin, histamine, and biogenic amine. As tick bites are often not felt, the first evidence of animation may not appear until several days. Even after the bite, after several days also, the patient will not even know that okay, tick has caused some kind of bite to me. Small macules or 3 to 4 millimeter on the site bite site you can find macule formation will be there. followed by this erythema as well as swelling. The patient often complains about the difficulty in the gait, followed by paralysis, eventually locomotor paralysis and paralysis. He will not be able to walk. Problems in speech and respiration may ensue and lead to respiratory paralysis. The tick is not if the tick is not removed from the particular region. Saliva of this particular Ixodes holocyclus has yielded a peptide holocyclotoxin 1 of that may cause paralysis. So that's what about the important things about toxin. Here in I found kind of in the Clayton CD summary I have found the all the collation of this one. So it is a study material in which I have seen class example venom symptoms and treatment they have given. If you look into the examples, we have black widow, brown recluse spider. Important venoms what we can see is neurotoxin, increased acetylcholine and sodium release, hemolysin and enzymes. So what are the symptoms we have and what kind of treatment can be done? Okay, in case of scorpions, you can see neurotoxin. Okay, and in case of hornets or bees or honeybees, uh, you can see anaphylaxis, hypotension, and renal failure. So, and this important thing we have really learned about scorpion, no roving eye movement. So, hope from this video you were able to learn about different types of spiders, scorpions, as well as ticks. Okay, their species important and their medical importance. What are the important medical toxicological components are there which are responsible, how they're inhibiting sodium channel or calcium channel or potassium channel, okay, how they're exiting their toxic effects. Okay, some of the examples you can try to remember, which is a part of a DABT syllabus only, as a animal toxin you have in the risk assessment, which carries around 38 marks. Thank you so much. Be curious. For any questions, please comment. You can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. All the best for your exam.